Hello and welcome to your first session of Dementia Awareness with Plato training. So I'm Michaela and I'm going to talk you through today's lesson, which is looking at Unit 1, Dementia Awareness. So for today's session, what we're going to be looking at is we're going to be able to explain what is meant by the term dementia. And we're going to be able to understand that there are different causes of dementia and be able to describe these. As part of your dementia training, you may wish to become a dementia friend. This is completely optional. It is an initiative run by the Alzheimer Society. And if you do wish to become a dementia friend, what this does is it gives you a short video to watch, or you can do a slightly longer version, and it just shows that you've got an awareness of what dementia is. And they actually send you out a little badge in the post as well. So if you do get employment or interviews in care work, you can show that you are a dementia friend, and you can show that you've got that little badge to prove it. It's quite a nice little thing, really. Whilst we are doing your training, what we've done is we've put on the right hand side at the top on each slide which questions relate to the slides that we're talking through. This is just to help you out so that if you're stuck or you're unsure where we're up to on the video, then you can have a look at the top right and see where we're at. So your level 2 dementia course, as I say, it's a level 2. This means that you're going to need to write a lot more than you did during your level 1 health and social care course. So you'll see that the verbs are the same. You'll see the verb describe, identify, explain, etc. But you do need to write more content than you did at level 1. This doesn't mean that it doesn't need to make sense. You need to make sure that you are structuring your work so that you are providing us with a quality of information at level 2. So not only the quantity, but also quality information. I have here some important words for this unit. This is going to relate to all of the work that you're doing. So dementia is a disability caused by diseases or conditions that affect the brain and that causes problems with the way the brain functions. The word symptoms means a physical or mental indicator of a disease or injury. Cerebral hemispheres, the key areas in the brain that are affected by the conditions and diseases that result in dementia, and they make up most of the brain. Depression, so severe dejection accompanied by feelings of hopelessness and being inadequate. Stress, being under physical, mental or emotional pressure. Delirium is mental confusion and changing levels of consciousness. And risk factors are the elements in someone's history or lifestyle that increase or decrease the chances of developing a particular condition. So these words relate to the entire unit, not just to today's session. So let's have a think about how we can understand what dementia is. So with dementia, it is not just one type of condition, okay? So dementia instead, there are over 100 different conditions that can cause the symptoms of dementia. So when we're thinking about the causes of dementia, you can also think of that as the types of dementia if you find that easier. So the causes of dementia that we're going to be looking at throughout this unit are Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. So each of these cause dementia, and they do it very differently. So for your first question, I would like you to list those main causes or types of dementia. Please pause this video here whilst you complete this question. So dementia is very complex. It is not easy to explain what dementia is. The World Health Organization came up with a definition of what dementia is, and we can see that on the screen now. So what they say is dementia is a complex syndrome affecting the brain functioning. It relates to irreversible loss of cognitive or mental capacity and memory, such that there is a decline in a person's behaviour and ability to function socially, physically and emotionally over time. So we can see from this definition here that it is not just affecting a person's memory. What it says is that there is irreversible loss, so there's going to be a loss in the brain of their mental capacity and of their memory, but that also because of that problem within the brain, because you're losing those nerve cells in the brain, what is actually happening is that people will struggle to socialise and communicate. People will begin to struggle to move around as they used to, and people will have a change in their emotional state as well. So dementia is an umbrella term. What we mean by an umbrella term is that although you can say the word dementia and people often recognise that as memory loss, it's actually a term that we use to describe over 100 different types of neurological disorders. So as I said before, we're going to be concentrating on just 4 of those because these are the 4 most common. So we're going to be looking throughout this unit and throughout the rest of your course at Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal lobe dementia. So dementia is not a diagnosis in itself. Instead, dementia is how you describe the disability that results in the damage to the brain. And what causes this particular condition or disease is either Alzheimer's, Lewy bodies, vascular or frontotemporal dementia. It doesn't mean that you won't hear the word dementia being used to describe people, but it isn't a diagnosis in itself. So you might hear somebody say, my mother's been diagnosed with dementia. But it's important to remember that there is much more to dementia than just that word, but it is a very convenient way of describing the disability. So some facts and figures here. So dementia is not a normal part of the ageing process. So although we are at a higher risk of getting dementia as we age, it doesn't mean that everybody is going to get dementia as they get older. So the likelihood of somebody developing dementia at age 60 to 69 is 1% for women and 1.5% for men. However, as we get older, the likelihood of developing dementia at age 90 or over is more than 33% for women and 25% for men. So if we just have a look at those stats a little bit more closely, so we can see that the chance of developing dementia for women is lower when they are younger at age 60 to 69 at just 1%. And then at 90 years it leaps all the way through to 33%, which becomes higher than the risk for men. So there are some changes there. But what it is really important for you to remember as part of this unit is that dementia is not a normal part of ageing. So just because people are over 90, it doesn't mean they'll all get it. It'll be 1 in 3 women will get it and 1 in 4 men will get it. We don't really know exactly how many people are in the UK with dementia. In 2011, the last time the census was taken, The figures showed there was over 500,000 people over the age of 65 that had dementia. But now they estimate there's over 850,000 people, so it has gone up. It's a growing condition, and 7.7 million new people are being told they have dementia around the world every year. So this means that somebody is being diagnosed with dementia every 4 seconds. So the number of people with dementia worldwide is expected to double or nearly double every 20 years to around 65.7 million in 2030 and 115.4 million in 2050. So as you can see, as the population is going to age, the risk is going to get more and more, because if you're living over 90, you're going to be either 1 in 3 as a lady or 1 in 4 as a man who could get dementia. So what does dementia mean? Dementia is a term that's used to describe a disability caused by diseases or conditions that affect the brain function. It is not a normal part of the aging process. The word dementia is linked to the word demented, so it does result in people having images in their mind of people being mad or disturbed or very aggressive or dangerous. So because of this, there can be a bit of a fear around the word dementia, because there can be certain expectations of how people will behave if they have it, because people have these preconceptions from the word demented. Most people have very little understanding of what dementia is and what life is like for those people who have it. There are lots of myths and stereotypes, so as we just looked, there was the word demented and how that can create derogatory ideas of how people may act with dementia. This can lead to misunderstanding of what dementia is for the person. It can lead to stigma and discrimination. But it can also stop people and their families trying to get diagnosis and treatment, because it can stop people from talking about dementia. Some people might say that people with dementia are crazy or mad or senile, but these statements are incorrect, because most people living with dementia actually live in their own homes and they care for themselves, but they have the support of their family members to help them out. Some people with dementia do live in residential care or nursing homes though, and we will look at that towards the end of your course as to the carers' roles and where they can be placed. So the stigma of dementia needs to be removed. If we think back to many years ago, people used to see the word cancer and ultimately they would fear death. People would assume that cancer meant certain death. However, nowadays, because of the advances in treatment for people with cancer and the advantages of early diagnosis, the stigma of cancer, I think there's still a certain element of fear, but not 100% what is going to happen, you are going to die. It's more of a what can they do to help you, and we look at it as a much more positive thing. With regards to dementia, the same needs to be applied really, but to remove that stigma of dementia, we need people to have an awareness and understanding of it to be able to move away from the mad, senile assumptions of somebody with dementia. So dementia is usually progressive, and this means that the symptoms will gradually increase or get worse and worse because the brain is becoming more damaged, so the disability is harder to live with. Not everybody's progression will be the same progress, so symptoms progress varies. It could depend on the circumstances for the individual, like where they're living and their physical health as well. It could be the state of their health and well-being, any medications they're taking, or the nature of the disease or condition that's causing the dementia. Some common symptoms of dementia Memory loss is probably the one that you are most familiar with. That is just one of them. Communication difficulties, and also changes in behaviour or mood. With regards to memory problems, people find it hard to remember things that have just happened, such as what they're talking about. So if they're having a conversation, it might be very hard to remember what the person just said to them. It could be very hard to follow a TV programme that they're watching. Sometimes familiar things like going to the shop or making meals can become confusing and difficult to remember. But these memory lapses won't happen all the time, but they will become more frequent. With communication difficulties, so as I just said, it could be difficult to follow a conversation because of those memory difficulties. It could be difficult to remember what the person has just said to you, but it's not just that. With communication difficulties, it can be very difficult for a person to remember the right word for an everyday object. It could be very difficult for somebody to remember people's names. It can also be difficult not only with verbal communication, but also with written information as well, depending on which part of the brain is affected. Communication difficulties can also become a bit more difficult for somebody if they have poor sight and they forget to wear their glasses, or if they've got poor hearing but they're not either wearing or have hearing aids. Changes in behaviour or mood. So when we think about this, we're thinking about those emotional changes. So people with dementia could have sudden changes with their mood. They might be angry, frustrated, or low or depressed. They might be frightened or confused. The mood changes are caused by differing realities and difficulty being able to understand the world around them. And because communication is affected, it might be that the person is using their behaviour to express how they feel. For question 2, I would like you to explain what is meant by the term dementia. Remember that when you are explaining at level 2, you need to make sure that you are using full sentences into paragraphs. So what we're looking at here is for you to answer your question with around 3 paragraphs that have got about 3 to 4 sentences in. When you're explaining, you might wish to use conjunctions or joining words such as but, however, because. Please pause this video whilst you answer that question. So now we're going to have a look at the specific diseases that we're concentrating on for your course. So we're going to have a look at Alzheimer's disease to begin with, because this is the most common type of dementia, or the most common cause of dementia in the UK. The exact cause of Alzheimer's is not yet fully understood because they're still doing research on this type of thing. However, there are some ideas of what your risk of developing the condition could be. So these risks are increasing age. As we already looked at, we saw that as you get older, your chance of getting dementia is higher. A family history with the condition, so it could be hereditary. Another cause of Alzheimer's is untreated depression, but it can get a bit confusing and there's blurs between those lines because depression can also become one of the symptoms of having Alzheimer's. Another risk factor for Alzheimer's disease is a lifestyle factor and conditions that are associated with cardiovascular disease. So when we're thinking about lifestyle factors, it could be smoking, and conditions associated with cardiovascular disease could be something like a heart attack. Alzheimer's disease is the most common type of dementia, so it's around 60 to 80% of the causes of dementia being Alzheimer's. In Alzheimer's disease, there are abnormal deposits of protein within the brain. So these deposits of protein block the messages so they can't get through clearly. So inside of your brain, you've got lots of nerve cells. The nerves carry the messages, and because there's a big blob of protein in the way, the message can't get through. There is also evidence of nerve cell damage and cell death within the brain. With Alzheimer's disease, people have difficulty remembering things, and they can be uninterested or depressed, and in the later stages, communication gets more impaired, people can make poor judgments, they get confused easily, their behaviour can change from their normal personality, and then over time people can have problems with swallowing or walking, so they get more physical needs. Because it's progressive, meaning that the symptoms are gradually developing over many years, it will become more severe because it affects multiple brain functions as time goes on. The first sign of Alzheimer's disease is usually a minor memory problem, like forgetting a recent conversation or forgetting the name of a place or an object. I do have another video here that you may wish to watch about a lady who lives with Alzheimer's disease. For question 3, I would like you to answer the question, what is Alzheimer's disease? So please write in sentences and develop a paragraph to explain this. Pause this video here whilst you complete that question. Vascular dementia is the next cause of dementia that we're going to have a look at. It accounts for a lot less cases of dementia, so it's around 10%, so it's a lot less common as a cause. In vascular dementia, there are problems with blood vessels within the brain, so it's different to the proteins that we just looked at in Alzheimer's disease. In vascular dementia, the problems with the blood vessels can be seen on a head scan called a CT or an MRI scan. Vascular dementia can cause impaired judgment, so difficulty making judgments. People can have a lack of ability to make plans, and they can have difficulty getting organised. So vascular dementia is caused by those blood vessel problems within the brain. This leads to a reduced blood flow, and because there is a lack of blood flow, the cells in the brain are damaged because they're not receiving oxygen from the blood. Because there's no oxygenated blood getting to those cells, the cells in the brain will die. I have another video here that you may wish to watch, which is a daughter's perspective of my mum has dementia. This is relating to early onset vascular dementia. For question 4, I would like you to answer, what is vascular dementia? Please write in sentences and develop a small paragraph. Pause this video here whilst you complete this question. Dementia with Lewy bodies. So Lewy bodies are clumps of protein that develop in the cortex, resulting in dementia. So you can see from the image on the right hand side, we have an arrow pointing to the cortex of the brain. So with Lewy bodies, the clumps of protein are very apparent. They can also be found in the cortex of people with Alzheimer's disease and vascular dementia. The most common difference of Lewy bodies dementia is the recurrent hallucinations. So you can get the visual hallucinations that in different causes of dementia, such as with Alzheimer's disease, but they are much more common with Lewy bodies. The visual hallucinations are about animals or people, but sometimes the hallucinations can be audio, like hearing sounds that are not real. So what is Lewy bodies, or what is dementia with Lewy bodies? Please answer this question now, so develop a paragraph using full sentences. Pause this video here to complete this question. Frontotemporal dementia. This is much less common, so it mainly affects the front and sides of the brain, so the frontal and temporal lobes. Think about your own head for a moment. So your frontal lobe will be where your forehead is, and your temporal lobes are where your temples are, so to the sides of your eyes. This type of dementia, or this cause of dementia, causes problems with behaviour and with language. So frontotemporal dementia is an umbrella term for a number of diseases, including Pick's disease. So you may wish to research this type of disease. You can pause this video here to do that. People with frontotemporal dementia can be a lot younger than those with Alzheimer's. Although Alzheimer's you can get younger as well, but with frontotemporal dementia it typically comes at the age of 45 to 60, but some can be younger and some can be older. People with frontotemporal dementia generally live a shorter length of time than those with Alzheimer's disease as well. So they are getting the disease younger and they are living shorter. There are behavioural symptoms with frontotemporal dementia, so people can come across as very insensitive or rude. They might act impulsively, so do something without thinking about the consequences. They can also have repetitive behaviours like rubbing their hand or tapping their feet. They can also have problems with mental abilities, like difficulty working things out or needing to be told what to do. They can have poor planning and organisation, and they can become easily distracted. So rather than looking at things like memory problems, instead we're looking at changes to personality in terms of their behaviour, their emotions and their mental well-being. So what is frontotemporal dementia? Again, I would like you to develop sentences to create a paragraph. Please pause this video whilst you complete this question. You should now have completed all of those questions for today's session, explain what is meant by the term dementia, and you should now understand that there are different causes of dementia and be able to describe those. If you haven't already watched those videos that I've put in the PowerPoint, then please make sure that you do click those in the description bar below.